My name is Denise Behrens. I am an occupational therapist and I work for Iowa Health Des Moines. We started with PCP about 3 years ago, and the reason was that our HR director came to me and said, you know, our work comp injuries are going up, and what can we do to reduce the injuries? What is out there? At that time, we were doing what I like to call the X-ray test, and the PCP is more of the MRI. We were doing functional testing for about 30 companies here in Des Moines, where we went out to their job sites, did an ergonomic eval, and set that up. But we had never implemented anything for Iowa Health Des Moines, which is a company of about 5,600 employees. So in 2007, we put a team together of physicians and therapists and nurses, and we really researched what it is that we can do to reduce our work comp, and we came up, after researching various companies, came up with Occupational Performance Company as the best and the leader in the field of what we were looking for. Since then, we started testing our top 4 work comp injuries here at Iowa Health, and that worked very well, and we started seeing some results. Severity of injuries is probably where we've seen the most savings. So we know that we're getting fit people in, they're getting back to work faster because they're coming in already physically strong. We haven't stopped all the injuries, but probably our severity dollars have gone down the most. And we are only a few years into this. In 2009, we bought our second machine because here in Des Moines it started really picking up. We have over 40-some companies now that we work with throughout the region, implementing the PCP testing for all of their pre-employment screens. We also, in July of 2010, for Iowa Health Des Moines, we brought on 27 more job categories to test because we felt like we were seeing significant results, and we know our long-term cost savings will be excellent. So that was our goal, to see now with our other things. And when we went around, the managers, when I went around and did job assessments and stuff, the managers were like, thank you, we want this. We want to know that we have physically strong people and that we do not have people out on medical leave as much because they're coming in doing the job. So that's probably been our biggest growth, and where we really find that the PCP has worked well. When I go out to the other companies, we do job assessments out to many other companies. I help them with their job descriptions and setting up their levels. I've talked to many lawyers and various presidents and vice presidents of companies and HR managers and risk managers, and most of the time the feedback is, wow, this seems like it's going to work. So we're just anxiously awaiting here the results in about 5 years to really get an idea of where the cost savings are within this region.